Hi, my name is Tassim.
And my name is Mishka, and we're fifth year medical students. You may be watching this video because your doctor has just told you that you have an anterior cruciate ligament tear, or you have just had a surgery to repair it. Now, the next step is to get you back to normal again, and so we have created this video to help you to be in charge of your own recovery. So we've included some basic exercises to maintain your knee health. However, you should consult your physiotherapist for more advanced rehabilitation. But let's start with some basic information.
So what is the anterior cruciate ligament?
So think about it as if your knee is held together by ligaments. These are almost like cables, and if these move too fast or too far, they can fray or snap. The anterior cruciate ligament prevents your leg from sliding too far forward.
How do we treat this kind of injury?
So we can do it non-surgically, where we just strengthen the muscles around your knee to help support the snapped cable. Or we can then do an operation to then fix this cable.
An operation? Are there any risks with this operation?
So after the operation, you may suffer from stiffness, weakness, and you might not be able to put weight on your feet. Hopefully this video will help to prevent some of these things from happening.
So we have 4 goals. Firstly, we'd like to reduce the swelling. Secondly, we want to make sure that we have a full range of movement so that your joint can move comfortably without pain. Thirdly, we'd like to ensure that you can walk on 2 feet. And fourthly, we'd like to make sure that we strengthen all the supporting muscles that support your knee to make sure that this does not happen again. To decrease the swelling, it is important to rest to allow your knee to recover properly. While you rest, you should try and place a pillow or towel or a jersey underneath your heels to make sure that your foot is elevated. You can also try and do heel pumps. This can be done to ensure that you increase blood flow to the area. It is extremely important to ice the knee. You can use frozen vegetables or a packet of cool water to do this if you do not have ice at home. You must make sure that you place the ice or the frozen vegetables in a towel or pillowcase to make sure that you do not hurt yourself. Lastly, to treat the swelling, you should try and apply pressure over the affected area. This can be done with a stocking or a sock, as shown. Make sure that you cut the tip of the sock so that you have a band. This band can then be applied and worn over your knee so that the area is compressed. If you experience any discomfort, pain, tingling, swelling, or change in color, remove the sock immediately.
So before we start the exercises, we're going to show you how to make some weights at home, because we know that not everyone has access to weights. So we're going to show you the exercises first without the weights, and then once you feel more comfortable, you can then start adding some weights. So let's start with the beans, bag, and string. So take 2 packets of any size and make 2 holes. First, fill it with either beans, stones, or sand to the weight that you feel most comfortable with. Then make 2 holes on either side of each bag and thread them through with string, like this. You then also need a packet of rice, flour, or any other packet of food which you feel most comfortable carrying.
A normal knee can bend and straighten. Lie on your back with both legs flat on the ground and place a pillow, a jersey, or a towel underneath your ankle. Hold this position for 1 to 2 minutes at a time. Lie flat on the ground with your legs straight in front of you. You can then bend the injured knee while keeping your heel on the ground and bringing it towards your bum. Straighten the leg while keeping the heel on the floor till it is straight again. Sit on the floor with your back upright and your legs straight in front of you. Your injured leg must be flat on the ground while your other knee must support while keeping your foot flat in front of you. Press the knee into the mat and try to tighten your thigh. While doing this, your ankle should lift off the ground as shown. You can hold this position for 10 seconds, then slowly release your thigh and repeat. Sit on a chair with your back upright and your feet firmly on the ground. You can then straighten your injured leg and slowly bring it up. Hold it in this position for 10 seconds and then slowly bring it back to the beginning position. You can repeat this until it becomes too easy, and then you can add a weight. The weight will ensure that you'll have a bit more resistance and the exercise will be more difficult. It is exactly the same, and you can repeat this again. Sit on a chair with your back upright and your feet firmly on the ground. You must try to stand up from this position while keeping your back straight and without holding onto anything else. Slowly sit down again and repeat. Once this exercise becomes too easy, you can add a weight. You can then repeat the exercise while keeping your back straight and without holding onto anything else, and slowly go down again and repeat.
So another one of our goals was to get you walking on 2 feet as soon as possible. Initially after the operation, you might be using crutches, and we'll be trying to wean you off of these as soon as possible. And initially, when you first start using crutches, try shifting your weight from side to side. If you're using 2 crutches, try to then go onto 1 crutch, and then eventually onto no crutches if you're feeling comfortable. Initially, when you first start walking, you should try walking 10 to 20 steps forward, backwards, and from side to side. You might first start walking with a limp, but this should improve with practice. You also have to work on balance. Try to start with something called cup walking. Place 5 cups in a line on the floor in equal distance apart. As you are stepping, the foot lifting off the ground should move over the cup, and try to hold it there for as long as possible before placing it down again. Once you are comfortable, you should also try to walk up and down flights of stairs to improve your ability to walk. Thank you for watching, but please remember that these are just general tips for people with only an anterior cruciate ligament tear.
If you have any other injuries, please make sure to speak to your doctor and physiotherapist so that they can create a personalized plan for you.